glomerulonephritis, focusing on the pathophysiology step-by-step process, treatment, and prevention. Pathophysiology of glomerulonephritis step-by-step process. 1. Triggering event, infection or autoimmune reaction. Often begins after an infection, e.g. streptococcal pharyngitis, or due to autoimmune diseases, e.g. lupus. The body mounts an immune response, producing antibodies. 2. Immune complex formation. These antibodies form immune complexes with antigens either from pathogens or self-antigens. These complexes circulate in the bloodstream. 3. Deposition in glomeruli. Immune complexes are trapped in the glomerular basement membrane. This leads to activation of the complement system. 4. Inflammatory response activation. Complement activation leads to recruitment of neutrophils and monocytes. Inflammatory mediators like cytokines and proteases are released. 5. Damage to glomerular structure. Endothelial cells, mesangial cells, and podocytes are damaged. Glomerular capillary wall becomes permeable to proteins and red blood cells. 6. Glomerular basement membrane thickening or scarring. Prolonged inflammation results in basement membrane thickening, mesangial expansion, and glomerulosclerosis. Leads to reduced glomerular filtration rate, GFR. 7. Clinical manifestations appear. Hematuria, proteinuria, hypertension, edema, and oliguria may develop. Treatment of glomerulonephritis. Treatment depends on whether the condition is acute or chronic and its underlying cause. 1. General supportive treatment. Fluid restriction for edema. Sodium restriction to manage hypertension. Protein restriction if kidney function is reduced. Diuretics to control edema and hypertension. Antihypertensive drugs such as ACE inhibitors or ARBs. 2. Treat underlying cause. Antibiotics if post-streptococcal infection. Immunosuppressants, e.g. corticosteroids, cyclophosphamide, in autoimmune causes like lupus nephritis. Plasmapheresis in rapidly progressive glomerulonephritis or Goodpasture syndrome. And 3. Dialysis or kidney transplant for end-stage renal disease, ESRD, if irreversible damage occurs. Prevention of glomerulonephritis. 1. Prevent infections. Prompt treatment of streptococcal throat infections. Maintain good hygiene to reduce infection risk. 2. Control autoimmune diseases. Proper management of lupus, vasculitis, or IgA nephropathy with regular follow-ups. 3. Healthy lifestyle. Avoid smoking, maintain normal blood pressure, healthy weight, and control blood sugar. 4. Regular screening. Regular urine and blood tests for people at high risk, e.g. with diabetes, hypertension, or family history. Thank you. Have a nice day.